what has been the incidence of nausea or vomiting during these 7 days? If you put it in numbers, was it 0 out of 10 or 2 or 5, 7 out of 10?
0.
0. Throughout it has been 0.
Absolutely.
Good. And you started with semi-solids, I think, within 2-3 days of surgery?
Yes.
Earlier you were on liquids.
Totally.
What kind of semi-solids you have been taking?
Curd, khichdi,
Right.
and egg white.
Good. So these are the advantages of mini gastric bypass. Like the main difference why you have no nausea, vomiting. The reason is the outlet is wide. The surgery is a low pressure system. Mainly it is all about pressures. If you look into this picture, because you need to have this picture registered in your mind.
Yes.
This will help you understand the procedure and help you handle the procedure in the future. Now your stomach is an extension to the food pipe. This is your food pipe. This is the new stomach. Although the stomach is small, but the diameter of the stomach is a little bit more than the diameter of the food pipe. We keep the diameter a little bit either more than the food pipe or equal to the food pipe, but not in any case not less than the diameter of the food pipe. And if we go by simple Bernoulli's theorem of science, and then it's very clear if we make it tighter here, then the pressure here will increase. So we don't want to increase the pressure because we fear the leaks. The worst complication in obese patients to have is a leak. So this is wide, and then the outlet. If you look at the outlet, it's a single outlet. It's also called as one anastomosis gastric bypass or single anastomosis gastric bypass. And one outlet, and that too is 5 centimeters, which is even bigger than the diameter of the food pipe. And that is the reason when you are eating, number one, you could eat quickly after surgery, say second, third day, as compared to the old classical procedures like sleeve or Roux-en-Y, where we have a high pressure system because the outlet is tight. That's the reason why you could eat semi-solids on day 2, 3. And I think you have been eating eggs also from day 3 or 4.
Day 4.
Yeah, day 4. Yeah. So now from day 8 you can start eating anything.
Right.
Because this should be clear that whatever you are eating, even if it is solid, if it can come down from the food pipe, there is no reason why it will get stuck here. I would say MGB is a non-obstructive functional restriction. Because how much you can eat?
Yes.
You cannot eat this much.
Yes.
Do you feel full after eating?
Like a bowl.
Like a bowl? You feel full.
Yes.
Now the question is how you feel full. Because even the surgeons who were doing other procedures, they would raise this question. If you are making the outlet wide, if you are not putting any bands here, not putting any rings, then how will the patient stop eating? That was the biggest question actually.
Yes.
And now after 20 years of this mini gastric bypass, now we know the answer. The answer is you are eating into the small intestine.
Right.
And small intestine is your new stomach. Actually, the old stomach which we have kept here is not a stomach anymore. It is just an extension to the food pipe.
Okay.
So we should rather say you are eating into your intestine.
Right.
And your intestine is a thin walled structure like a tube, like the tube of a bicycle, almost of similar diameter and almost of a similar thickness. It's distensible, thin, and once you eat, it will distend slightly.
Right.
And say if you eat one slice of pizza or half burger, it will distend. And that distension
You feel full.
will send signals to your brain that you are done.
Right.
And that is exactly what we want actually.
Right.
After bariatric surgery, we need to have that feeling that I am okay, I'm good. I don't want more. Because if we put a ring here, like if you look at the structure of the gastric band, this is a ring here. And this is a mechanical obstruction.
Yes.
Once you eat, it will get stuck here, it will not go down. And then you will have the feeling that suddenly, something has got stuck. And you will not like that feeling because you are not saying that you are good, you are done. Your brain wants more, but there is a lock inside which is not letting the food go down. And then you will find some other solution to it. And you will try to cheat the band by taking soft calories, by liquids. And that liquid can go down easily. Even if it's a 1.5 centimeters outlet here, any liquid can go down easily. So that is why these patients who were getting the restrictive techniques were having high incidence of failure because they would tend to have their taste develop towards soft calories. And the same was the story with the sleeve. Here we have resected the stomach,
Right.
the outlet is tight.
Right.
So sleeve patients, it's not that sleeve doesn't give results. Sleeve gives good result. Like you were offered sleeve at different places because such a difficult patient like you, this procedure is easy to go for.
Right.
And sometimes we have to do sleeve if we are not able to do mini gastric bypass. And sometimes if the liver is not good, we rarely find, cirrhotic liver inside. Because in obese patients, any machine will not be able to pick up the exact texture of the liver. Even if it's a CAT scan, most of the patients would not even fit into the CAT scan machine. And even those who fit, they have a thick layer of fat here, which obstructs the readings of the CAT scan or the fiber scan. So if we see that the liver is not good, even in that scenario, we don't do a mini gastric bypass or any kind of gastric bypass. Then we'd go ahead for sleeve. And earlier, if we go like 40 years back into the literature, sleeve was actually used as a step 1 procedure. Like do sleeve first, and then later on, like in your case, if you're a super obese man, so do sleeve first, and after 1 year, convert it into a gastric bypass. And if there is cirrhosis, do sleeve first, and after 1 year, once the liver has shed good amount of weight, once there is no fat inside the liver and it turns better, and then you convert it into a gastric bypass. But with mini gastric bypass, like your liver was looking good, so we went ahead with mini gastric bypass. In sleeve, you have a valve here. This is called pyloric valve. And then there's another valve at the inlet. So in MGB, the inlet valve is there, but the outlet valve has been bypassed.
Right.
But here, that valve stays here. So the stomach was like a big balloon, and now it has been converted into a tube, and once you start drinking anything, it will not go down easily. So it will try to come back. And high pressure will be generated here because of this obstructive valve at the outlet. But in MGB, if you look at the structure of the MGB, there's no valve here. It's a 5 centimeter wide outlet without any obstruction, without any ring or band. The valve is on this side, it has been bypassed.
Right.
So that is the reason why there is no nausea and vomiting, and that is the reason why the incidence of leaks
That's right.
is so very low. In our series, it has been reported to be amongst the best results in the world.